Hi, this video is a video of the before and after on a patient I have had a hair transplant done. This patient had a procedure done done by me a year ago, but he had prior to that he had a procedure done in the past for hair transplant, which left him with some plugs. Before we go further, I would like to show you what he looked like before. As you can see, the audience, this is what it looked like. He has a lot of plugs going, and the hairline, it just straight up like this. They don't do a natural curve and those stuff, so leaving with like very harsh triangle, and then on both sides. And so this is him before, this is him afterward. Very nice and natural. You can see the plugs and up there. Very good. Let me show you one more. This is on the left side. You can see the angle is very harsh around this area. Is leaving with that, so I lower his hairline to fill it and make it more a natural angle. And this is him before, okay, on the right side, and this is him before on the right side. See a big difference? There's a lot more plug, and it's very unnatural, more plug and unnatural look. But here, when I lower his hairline, it looks much nicer. And this is him in person. And this is him now on the picture. Looks very good. And this is him in person. And before you go further, I'll let you go to my website at mhtaclinic.com, 1-866-999-6482. So getting back to this patient, I'd like the audience to know that hair transplant, corrective hair surgery works. My name is Dr. Diep. I specialize in fixing plugs, and you don't have to walk around and have a harsh pluggy look. Even though you have a small plug, not a small one, not like in the past, but it's still a little visible, and if the location too high or a little bit too awkward, it can be fixed. It can be look very natural. In the past, it take multiple steps, but now I found a way where we can do all in one sitting. On most patients, but there's some patient is too harsh, then we might need to do one more. But on this patient, as you can see, his hair looks very nice and natural, very good. I'm gonna have you turn this way. You see how natural his pattern is. And there's no more plugs, none of that stuff. Look at this side, and this is him. So this is the before and after on a patient who have had a hair transplant done by me, a corrective hair surgery. We did the both technique. We did the strip technique, and we did the FUE to pull out the plugs, thin out the plugs, and redistribute them. And to demonstrate what happened with this patient was, he has a lot of plugs right here. And what I do was I punch him out, I thin him out by the FUE method. I'm an FUE specialist, and then you don't lose the hair, you just redistribute and put them all different area, and this can be a result into this hairline. Very nice and natural, and no one can tell he have had it done. And some people would do put hair in front of the hairline, but leave the plugs there and not doing anything, and that won't work. That will make it too harsh. The hair in the front won't hide it. It's called transitional zone. It won't work. So there's three ways to fix the plug. Number one is to excise the whole plug out, but that's too traumatic. It leaves you a big, really nasty scar, and the patient will feel numb on the front scalp, and too much trauma, and the end result aesthetically won't look good. Number two method is the putting the transitional zone in front of the plugs, but without removing the plug. But that won't work either, because the transitional zone is too thin, and it won't hide the plugs, and you end up with some thin hair in the front and then the harsh stuff in the back, and people will notice it more. The most advanced technique nowadays, called the FUE Corrective hair surgery, combined with the transitional zone built in front of it, and that's the most effective way. And how do I go about that? Is what I do is, at the same time I I thin out the plugs using the FUE Corrective hair surgery, and you don't lose any hair. I just redistribute it and put them all around to the surrounding area, and then I built the transitional zone and draw his hairline the way it should be, and then that in front of it to hide the any scar if there are any, but there's no scar really, and then to really make those plugs thinner and more natural. And by combining both methods, this will give you the most natural result. It will be the fastest way to fix the FUE Corrective hair surgery, and you can go back to normal. The old technique where they put the plugs, a lot of times they do it too high and not building the corner, not filling those stuff, so the location affect you too, how you look and those stuff, and not only just the plugs itself. So for me, I'm the type of surgeon who specializes in this technique, and I specialize in making sure that the hairline is very natural, and it can be done. Thank you.